Hi, this is Sindhu Ernala, and on behalf of my co-authors Kathan, Amir, Munmun, Asra, John, and Michael, I'm going to talk to you about our CSCW paper on mental health transitions as they're exhibited on social media. In the past decade, a growing body of work in HCI and CSCW has studied how social media use and digital traces that individuals leave behind on these platforms can help us understand mental health experiences. In one line of work, researchers have explored computational and predictive approaches using social media data to infer people's mental health states, targeting different conditions, platforms, and disciplines. And in another line of work, researchers studied people's motivations, their goals, and practices in using social media for social support and help-seeking behaviors, often outside of clinical treatment. However, pathways to social care relating to social support and navigating stigma, and pathways to clinical care relating to symptom management are not dichotomous. Both social relationships and clinical care are required for the overall well-being of those with mental illness. And this is in fact posited by the recovery model, which is the guiding principle for mental health care worldwide. The recovery model argues that both clinical recovery and social reintegration need to go hand in hand. However, research in this area has heavily focused either on clinical diagnostic interventions or self-management of the condition and social support. In this paper, we bridge this gap by synthesizing viewpoints from both clinical and social care to study mental health-related transitions surrounding psychiatric hospitalizations as they're exhibited on social media. For the study, in collaboration with clinician experts, including psychiatrists and clinical psychologists at Northwell Health, we recruited 254 individuals who've experienced a psychiatric hospitalization, either for schizophrenia, mood disorders, or other conditions like borderline personality disorders. With informed consent, we collected participants' hospitalization data, including their date of admission, as well as their Facebook archive data, including self-posts and comments. Across all participants, we have 585 recorded hospitalization episodes that form the unit of analysis for this study. To study people's illness trajectories surrounding psychiatric hospitalization, we adopted Gaussian mixture modeling, a probabilistic model that clusters heterogeneous multimodal data into a fixed number of coherent components as our approach. Now you might be thinking why GMM makes sense here. First, existing behavioral change models for mental health assume homogeneity across all individuals. However, we want to model for heterogeneity in people's experiences and how they show up on social media. We also want to model for multiplicity, that is, the same individual can have different sets of behaviors surrounding different hospitalization events. Here, unlike traditional clustering algorithms like k-means that perform hard clustering, where each data point is assigned to a single cluster, GMMs perform soft clustering, where each data point can belong to multiple clusters with different weights. Our modeling approach proceeded as follows. First, we identified temporal periods surrounding each hospitalization event. Then, we adopted Gaussian mixture modeling to identify common behavioral components across the temporal periods and across all hospitalization events in our data. We then validate and interpret the latent GMM components to derive an empirical taxonomy of mental health statuses around psychiatric hospitalization. In this talk, I'm going to focus on the modeling and validation steps, but you can check out details about other steps in our paper. First, we identified 4 temporal periods surrounding each hospitalization based on the empirical distributions of posting volume over time. The 4 periods are long before hospitalization, before and after hospitalization, and long after hospitalization. We compiled Facebook timeline data across all hospitalization events, now segmented into the 4 temporal periods, and we operationalized linguistic and behavioral signals during these periods in a theoretically grounded manner. Then, with each temporal period around hospitalization now represented by these features, we fit Gaussian mixture models for different values of K that show optimal fit based on information criterion scores. To validate these behavioral components inferred from the GMM, we adopted a qualitative protocol. We ran the Gaussian mixture model and then discussed the extracted components with 4 domain experts, including a clinical researcher and practitioner. We used their input to help interpret the latent components, and we conducted semi-structured interviews and follow-up sessions to iterate over the component labels. With this approach, we derived 6 heterogeneous behavioral patterns that characterize people's experiences surrounding psychiatric hospitalization. On the slide here, I'm showing the heat map of membership probabilities of each of the 6 statuses around the 4 temporal periods surrounding each hospitalization. And we already begin to see the heterogeneity in how people use social media and what forms of behaviors are exhibited on these platforms during psychiatric hospitalization related transitions. For instance, the withdrawal focus status, which is most dominant immediately after a hospitalization, is characterized by overall reduction in posting and activities on Facebook. In contrast, the incorporation focus status, which is also most dominant immediately after a hospitalization, involves people talking more about their mental health experiences on social media. As part of this status, people share more messages and connect one-on-one with friends on platform, and they share more experiences related to their mental health online. This taxonomy now lets us understand people's illness trajectories in terms of the statuses that they exhibit over time. So we use the taxonomy to model linear transitions surrounding hospitalizations by modeling the transition probabilities between consecutive statuses that are exhibited over time. This slide shows the most commonly seen recovery trajectories based on the taxonomy. On the left-hand side is the status that people exhibited before hospitalization, and on the right-hand side is the status that people transition into immediately after hospitalization. And we begin to see the different journeys that people have surrounding psychiatric hospitalizations and how they show up online. First, we see that people most commonly transition into the incorporation focus status or the withdrawal focus status immediately after hospitalization. We can also see more nuanced insights here. For instance, 66% of the transitions that go from the incorporation to the withdrawal focus status are seen during the first hospitalization event that's experienced by people. On the other hand, the majority of cases where individuals remain in the incorporation focus status before and after hospitalization is observed during people's subsequent hospitalizations, like it's the 4th, 6th, or 7th time someone was hospitalized for the condition. Similarly, we are also able to study transitions from immediately after hospitalization to long after hospitalization, and this lets us model reintegration trajectories. In the paper, we demonstrate the utility of the taxonomy by also assessing social media signals that are indicative of individuals' reintegration trajectories after hospitalization. In summary, in this work, we show that social media data can be utilized to study people's clinical recovery and social reintegration trajectories, and we contribute an empirical framework of mental health transitions. Our work aligns with prior literature where scholars have expressed criticism of disjoint conceptualizations of the individual as just a patient or a support seeker for mental health. Drawing upon our work, future research leveraging social media for mental health can benefit from noting that people's mental health statuses and their exhibition on social media are heterogeneous and contextualized within the individual's specific needs for clinical treatment or social support. In the paper, we talk in more detail about how the taxonomy can guide post-discharge support and care, bearing clinical implications, and how social media platforms can be designed to support social reintegration. Please check out our paper for more details. Thank you for listening.